Hello, I'm Hogne from Ecology, and
I'm Olaussen from Ecology.
and today we are going to talk about how you can maintain a healthy muscle. And of course we include how to utilize omega-3 in that context. And you know, muscles are important in the body, not only to show the very strong muscles, but it's so important for all of the movements, how to be the right position to stand up and the body is tall and nice to look to. It's important for the heat production, it's important for the blood circulation, and it's important to have enough power to breathe when you need oxygen to the body. But, Carine, it's not always positive, is it?
No, because like you said, muscle mass is important for so many functions in our body that losing muscle mass has a severe effect on our health. Because losing muscle mass weakens our immune system and it will make us less resistant for disease and our body is less able to fight disease. Same time, when you lose muscle mass, you lose muscle strength and you lose your balance. So everyday life will get more hard, difficult.
So this means that, in fact, if I don't look after my muscles, something awful may happen. Is that what you say?
Yeah, you will more easily get sick. And you know, when you don't have the strength or the balance, you will not be able to handle everyday life as normal. So,
And what is everyday life? What kind of situation is it that especially can make us to lose more muscles?
So what we see for most people with age, unfortunately we lose muscle mass, and this is due to less physical inactivity and a poor nutrition, and also many medical conditions that can affect this. So we have many muscles in our body, and when we are young and healthy, we have lots of muscle mass. But for most people, with time, we lose a little every year. And what we see is the first decades, we lose maybe 3 to 5%. But the older we get, this speeds up. And we see elderly people, they will lose muscle mass very quickly.
So that means that when you come for young people like me, 70 years plus, that means that if I do not do anything special, I can lose up to 2% of my muscle mass every year.
Every year, and you can lose 2% in a week even.
Yes. So that is why it's important for both of us and everybody listening that we need to be active to secure that we have enough muscles.
Yeah.
And what should we not do?
Not do. Well, most of us, we don't move anymore because, you know, our daily life is usually sitting in front of the computer, and often when we come home, we lie on the couch and we watch the television. And this is just death for our muscles, because if we don't use our muscles, our body won't look after them.
And the difficult word for this is what we call sarcopenia. Yes. That when muscles are reduced in volume, because it's mostly they are reduced in volume. We still have the number of muscles, but they don't have the same volume, they don't have the same strength. So that is by being inactive, that's what's happening. And nutrition, is that important?
Extremely, yeah. And what we see today, with all our ultra-processed food and...
Yeah, it means that if we are eating, we talk about grassing, we are so busy, we never have a real meal, and we just take carbohydrates or whatever, even Coke, or I can't say that, but you take things just to have the energy for the next minute or next hour, and then that is not very good nutrition for the muscles.
No.
Some of us also happen to come to hospital, and whatever you have or treatment there, very often, perhaps this is more a few years back, people were put to bed and say, no, you have to rest and recover. And rest and recover, that perhaps some elements in the body need a rest, but for the muscle, what happens when you rest too much?
When you rest too much, I mean, the muscles, they just disappear. And our immune system uses a lot of protein. So when we have an infection, our immune system will go to our muscles and get the protein to make all the molecules that will fight viruses and bacteria. And also, if you have broken a bone in your body and your immune system needs to repair it, they use a lot of protein, as well as if you have a wound. Mm-hmm. That requires so much protein to repair that wound.
And Carine, you have been working before you came to the fantastic company Ecology with putting together special diets and nutrients for people with diseases. And the idea for that was that to let people remain with the same muscles? So what was the idea to make these kind of new diets?
Yeah, maybe the main thing they work to do with medical nutrition is actually giving the body the nutrients to spare the muscle mass.
Yeah.
So that is very often, during disease, that is often the main goal, to save the muscle mass.
Mm-hmm. So now we see something that is not so good to do if we will remain muscle. And the idea to stay healthy, from what you have said and what we have discussed, is that if we can postpone loss of muscle, postpone sarcopenia, that means that we also are able to stay more healthy for the whole body.
Yeah.
And on this picture, we say something that by exercise, we really can, by have resistance exercise, that means to train your muscles with some weights, whatever we showed in the early picture. If we have the right intake of proteins, if we then also secure that we have the right vitamins, because that is not obvious that we get that in all kind of food. And then we see that there are several elements here that we need to take care of in order to have strong muscles that have so much impact on the health.
Yeah. And like you say, you need to do resistant training. Like you said, we can't just be joking around, and that's very, very good to do that too. But we need to actually do some heavy lifting. And what we often see is that, especially women, they're often a little scared to actually lift, because many are afraid of getting like big muscles. But we really need to stimulate the muscles, because if you don't use them, the body won't take care of it, because it's a lot of work for the body to take care of your muscles. So if the body thinks...
So that is, even if we in Norway love to hike and be out biking or whatever, in addition, what you talked about also for the immune system, whatever, we need to maintain our muscle mass and exercise and use the muscle. And that is so important even for healthy young people. To start with that, they don't need to do to take new world record in many kilograms and so on, but they need to do it a little, say a couple of times per week. Lift some weights, and then you really stimulate your immune system and a lot of other things. So this woman, of course, is extremely strong, but just to do a little and several times, not only once, that's good. That's good. And when we talked about protein, is this super processed, ultra processed food healthy, or what will you say about that?
Yeah, I mean, a lot of that food contains just a lots of carbs and fat, but very little protein. And protein is like the main building blocks of our muscles. And we need enough protein for the body. We need just to give our body the right tools to actually be able to build.
And I think this is so important that even for healthy bodies, they need building bricks to replace old cells with new cells. And we see that even for young people, we talk about around 1 gram per kilo body weight per day. And when you get older, you need even more.
Yeah.
So this is not only for diseased people, it's for everyone that need to secure that in the diet we have, it should be enough protein. And as a medical doctor, I know that this is where we really are behind in most advices for normal people. So elderly people that are not hungry anymore, they should force themselves to eat beautiful protein food.
Yeah, and that's what we often see with elderly people, that suddenly if they used to make a sandwich with like ham and cheese, so with lots of protein, suddenly it's only ham, and only jam.
Yeah.
So all like the protein-rich meals are often replaced with less protein.
Not good.
No.
And here, of course, you see this is the type of fish we find in the ocean, full of vitamin D, calcium.
Yeah.
No, this is of course a cartoon, but here we are of some of the secret elements that need to be included in the diet in order to help the muscles.
Yeah, because sometimes I think people get a little bit lost in that whole protein focus, and of course protein is really important, but we have to think holistically about the diet, and I would say people often forget about the omega-3.
And is vegetable important, or what will you say about that?
Oh, vegetables are, of course they are important, but they often don't have what we need for muscle mass. They will have some minerals and they will have some antioxidants, which is good, but that's not where we get the building blocks for muscle.
So of course we also need vegetables, but the main thing for the muscles is that we have enough of the protein building bricks, but also these vitamins that will facilitate a good end point when you build new muscle cells or content. So when we talk about muscles and have strong maintenance of muscles, it's several things that have an impact on that. And we know that even if we are young and healthy, there are differences in hormone balance coming through ages. There are differences in lifestyle. So when you come to both for men and women, we know that the differences in hormone mirror is one that has impact also on body composition. That was what this picture should try to visualize. It's also important in a hectic life to sleep enough. Yeah. If we read about all the improvements in the body to come over the daily hectic life, then sleep 8 hours per 24 hours should be the ideal thing. So I know that perhaps a lot of you listening to us today are not able to have 8 hours of sleep. It is important for the body to recover, to have enough rest in between.
Because it's when we sleep that our body actually repairs. When we work out, that we actually ruin the muscles when we work out. But when we rest, that is when our body will repair and build.
So if we are reading about all the advantages by having enough sleep, that looks like the miracle drug in the world. Yeah. So it's important to sleep enough. And that can, of course, be individual. From somebody need 6 hours, somebody need 10, but at least the body need to rest in between all the other things. Yeah.
And then you have people with chronic conditions like for example, diabetes or cardiovascular diseases or diseases that will have your immune system constantly working on inflammation. And I think that's where the omega-3s come in, because if your immune system is constantly working, your body will prioritize the protein to the immune system, and it will just tear on your muscles. So by managing that inflammation is just crucial for
and when you come to friends on my age, most of them have some pain and a nice talk over a cup of coffee, and you just need to wait 2 minutes, and then it's a lot of pain and problem all over the place. So therefore, this chronic inflammation is a part, it's not naturally needed to be there, even if you get older, because we have some simple tools to overcome some of these chronic inflammatory situations.
Yeah, and when you have like good joints and you're able to move, that's also when you're able to exercise and stimulate your muscles, because when you have the pain, you see people, they become very inactive because it hurts to move around. So
this is catch-22. So in fact, if we are able to have healthy muscles, then you are able to use the muscles, then you are able to improve your immune system. So this is the positive way. If you have pain, you don't move, and then it goes worse the other way around. Yeah. So now we are going to just point to some of the advantages that is documented and we know is around the omega-3. So if we then have an daily intake of omega-3, DHA, EPA, and that should be at least 1 gram per day, then we can see some of these advantages. So I can start then to say that that omega-3 will enhance muscle protein synthesis. We said earlier that we have a lot of muscles, and in fact the omega-3 will not increase the number of muscles, but it will increase the size and the function of each muscle cell. So therefore this is an important part, and we have some receptors and some mechanisms behind that called mTOR. That is very difficult. So that is more to say that by omega-3 activating this pathway, then we will secure that the muscles, they will develop in the right way and they will rest in the right way. And therefore we have this small, it's a lot of knowledge about mTOR, but you should just know that omega-3 will stimulate the right way for the muscles to develop.
Yeah.
And next.
Yeah, so again with omega-3, when omega-3s lower inflammation, you know, when you have a really good workout, you will get sore, and that's when, you know, that's inflammation. And that's also when your immune system kicks in. But again, with omega-3, you will recover faster. And that's also important to, for the next workout.
And we have several people, top athletes, really experiencing that they have a shorter period to recover after a tough exercise by having sufficient amount of omega-3 in the daily intake. And we come back to what the sufficient amount should be.
Yeah.
And when you look into another advantage, perhaps a little the same, but this is muscle recovery. Because as you said, Carine, is that every workout, then we in fact destroy some of the binding between muscle fibers, and the muscle fibers need to be repaired in order to be ready for the next hard competition or whatever. So therefore, omega-3 will really improve muscle recovery, the time, in addition to this, the soreness.
Yeah, and like I said, take care of your joints, because, you know, so many, for example, if you like to run and suddenly your knee hurt and then you can't run, you become inactive. So it's really important to just take care of, so you're actually able to move. Yeah.
And I think also what you mentioned is that if we do not have enough good nutrition for the muscle, then suddenly the body will use muscle as the fuel for other functions in the body. And then you really also lose muscle mass, because that is needed for metabolism. So it's a lot of things that is negative. And then preservation of the muscle mass. Most of us would like to look slim and fit and don't fat and lazy. So therefore, to preservation of the muscle mass also have an impact on how the body looks like and function. Will you say something about this?
Please, you can.
so because it's not only working directly on the muscle fibers, but also on, when we talk about here, the function, how the different neurons are connecting with the muscle fibers, and then giving signals to the muscles to work the way we want them to work. So omega-3 is then also important for what is called here the neuromuscular function and how they work together. And this one you can take.
So again, when you have the omega-3s creating the cell wall in our blood vessels, so they become more flexible, and you can actually, you get the oxygen to the muscle, you get the nutrients to the muscles, and just actually getting what our body needs, the tissue needs to actually perform and lift.
And that is also very important when you see on athletes.
And omega-3s, they will also affect your performance when you work out. So you will get like an increased endurance, for example, with running or cycling, and you will be able to actually push yourself a little bit further with the omega-3s. And
the good news is that for you that would like to be world champion or whatever, omega-3 is still allowed. It's no dope. But from all the knowledge we have, then it really supports muscle strength, recovery, and perhaps even that you are able to continue for a longer time with less muscle pain. So therefore, Just listen to this if you're an athlete or would like to compete with some Norwegians. This is the secret tool we have used for many, many years.
Yeah. How much do we need, though?
Yeah, and here it comes, because we know that it's a load to talk a lot about health benefits with taking 250 milligram omega-3, DHA, EPA per day. But if you would like the body to be more optimal, to be the best version of yourself, then our experience and our knowledge is that 250 milligram is all too low.
Yeah, it's not enough.
So
No.
this is the then typical Carine, business lady sitting in front of the computer all day.
I work out too.
Oh,
so
I know,
need a little more.
But then you see that even for healthy young people, we will recommend between 1 and 2 gram per day. Even if you don't are the top athlete, that's okay. And what will you say for elderly people then?
Yeah, because if you really are focusing on building muscle mass and you're stimulating your muscles, you might need more, because we do see that when you start working out, the omega-3 status and ratio, it gets a little off balance. We see we need to increase more, basically because our body uses more and our immune system is more activated, and we need to increase it.
And we talked about for elderly people that a lot have chronic inflammatory situation.
Yeah.
And there we know that then you have a daily consumption of EPA, especially omega-3 anti-inflammatory things, meaning that in order not to exactly build more muscle, but repair the muscle you have and maintain your muscle, 2 to 3 gram might be the best for most people.
Yeah, but I'm not sure if you have noticed, but I noticed that now that, the recovery after a tough workout gets longer and longer. In my early 20s, I would just
even
bounce
you
back,
experience that, yeah?
Yeah, but it starts early. You can actually tell that it takes longer to recover, and that's why we need to boost that recovering process.
So that is 2 to 3 gram, and if you really would like to be a world champion in something,
yeah, then you need to really increase. We see in athletes, it's just the omega-3 ratio, it is completely off balance. So they need to constantly be aware of their omega-3 intake.
And what we have learned from athlete education and exercises in Norway is that most athletes should take 5 gram EPA DHA per day in order to have less muscle soreness and have better performance and be able to compete with all the rest of you in Europe. So even if these numbers are not based on very scientific background, it's a lot of experience from athletes saying that they feel much better and perform better with this tool. So I think that after this conversation, you should be aware that omega-3 is a fantastic compound that is important in all ages, and for muscles, that is perhaps the organ that is most valuable for all of us to stay healthy and be able to work around and have fun. Then omega-3 is a critical compound. So, Carine, thank you very much for this fantastic conversation, and good luck for all of you using our products. Bye-bye.